Well, Kelly Clark is the Marketing and Communication Specialist with Titusville Area Hospital, and she joins us this morning. Hi, Kelly. How are you?
Hi, I'm good. How are you doing today?
Good. Good to see you.
Good to see you.
Good to see you back at the table. Usually we have you, in the corner hiding somewhere. But,
I know. You give this nice table to all my guests. So
you are the guest today because there
one
is
and only.
so much to talk about.
Yeah.
Where would you like to start?
Let's start with the best news of all.
Okay.
You don't
It's
want
all
to guess.
good
You don't want to
news.
guess. Yeah.
It's all good, though.
So recently, CMS, which is Medicare and Medicaid Services, they released a ranking for all hospitals. So Titusville Area Hospital was ranked 5-star hospital, which is the highest ranking that you can get.
Congratulations.
Yeah. So there's only 455 5-star hospitals in the whole nation, and actually only 22 in Pennsylvania. So this 5-star rating is based on 48 measurements. And there's 5 different categories that they take those measurements from. So it's mortality, safety of care, readmission, patient experience, and also timely and effective care. So across the board, if you do well in all of those areas, then you attain the 5-star rating. So we're very proud of that.
That's awesome. Congratulations. A lot of hard work goes into that.
Yes, definitely.
Yeah.
So it's really great to be recognized as only 22 in all of Pennsylvania.
That's great.
Yeah.
That's awesome. And it says a lot about everybody up there.
Mm-hmm. Yeah. So, we have a lot of great people, and, we have, so many statistics that we watch and try to improve on every year. And so obviously, our work is paying off.
And that, I think one thing during COVID that really stands out is how important every job is, from custodial to, maintenance to, everybody plays a role.
Yes. And, so many, we always recognize our nurses and our doctors for sure. But yes, you are correct. There is no way that, we could get by without our lab team, our custodial services, our maintenance team, our administration, even our cafeteria workers. They are really doing a lot to help support everyone there. So
and on that line, you guys did some grilling a couple days ago.
We did. Yeah, it was hospital week last week. So we had the administration do some grilling. We also did some beautification of the area, pulled some weeds, planted some flowers. So it was really great. Got the hospital spruced up, and it was great to recognize our employees and give them a picnic. And they also got a little gift. Everyone got a gift for hospital week. So it's great to recognize them.
Yeah, what a year, and a lot of hard work.
Definitely.
So congratulations there. All right, what's next?
So we also have speech and OT at our hospital, and they're offering free screenings for any kiddos that may need some extra support this summer. So even if they're already receiving support in their school or in their pre-K system, wherever they are right now, they can come in for a free screening and see if maybe the services that we offer, the speech and the occupational therapy, would be beneficial to them. We are having face-to-face, so a lot of organizations aren't offering that yet due to COVID. So, and that's hard to do. If you're a speech therapist and you're trying to do something remotely, that's very hard to keep a child's attention. So we are offering face-to-face. So they are doing free screenings today and tomorrow, and you can sign up online at our website, or you can call the hospital, ask for the speech department, and get an appointment for that.
Very nice.
Yeah.
Excellent. Big golf outing coming up?
Yay! Yes. So the countdown's on. It's in 1 week, which
wow.
So we are busily scurrying around. We've had a lot of great donations given to us, a lot of great support. We've had so many sponsors come forward, a lot of our vendors that have stuck with us through, this tough time right now. So they have all stepped up and have a ton of teams this year. So we're really, really excited to get out there, do a big fundraiser. Obviously, it was canceled last year. So this will be my first. So I planned it last year, and then it got canceled. So this year I said, Holly, it's happening. It has to. I won't cancel another one. So yes, we have a lot of great sponsors that came through for us. If anyone out there, hasn't that we haven't reached out to for one reason or another that wants to do a basket. We have a big raffle baskets giveaways. So if anyone wants to donate anything, you can call the hospital and ask for the foundation office. And you can talk to either me or Holly Wolf, and we can pick that up for you. We love anything donated by the local community, to show support. So
this is a great fundraiser, and it really goes to just, again, the care for the community. A lot of great things are purchased with some of these funds.
Yes. So this year, our Golf Scramble is going towards our new CT scanner. So the CT scanner that we have right now is older. It's over 10 years old. So the technology, the software, really just the quality of the image, we really need to upgrade that. And it's a giant cost for our hospital. The whole project is a $500,000 project. So that's where all the funds that we raised during the Golf Scramble are going towards. So, yeah, we're hoping to have a really, really great turnout and raise a lot of money for that project.
What's crazy about that is the scanners today are less expensive than they were in the past, but they're still costly.
However, since we're making this improvement, we're actually going to renovate that area as well. So some of the other costs that are in that project is the renovation of the area. We're making it a little bigger so you can get wheelchairs in a little bit easier.
Nice.
Our current area does meet standards. However, it is a little tight to get wheelchairs and stretchers in there, which a lot of times that is who's coming into to do a CT scan, or folks from the emergency department coming over, and they are sometimes immobile. So we just want to, since we're getting a new scanner, we're just going to renovate that whole area and make it all new.
Yeah, that's great. And it seems like to do both for that price is outstanding. So
Yes.
Yeah, that's awesome. Well, let's do this real quick. You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel, and listening to it on the Allegheny News Talk Sports Network. So just know when you golf that you're going to have a lot of fun, but the money raised is going to a fantastic cause. So
Yeah. We have a lot of great prizes. Like I said, we had a lot of donations given to us, and we purchased some prizes for giveaway. So
excellent.
We hope it'll be great.
So that's next Wednesday.
Next Wednesday, yeah.
All
So
right.
anyone looking to donate or be a sponsor, you can contact me at the foundation office.
Great. All right. Next.
You tell me. What was next?
Well, you're talking about renovating the space
yes.
for the
How
CT
could I
scanner.
forget?
Should we segue into?
So I told you we weren't going to talk about this again, but we are.
We are.
So
Okay.
we're gonna, maybe this will be the last time. So we recently finished the ER. So we had that was a giant project. Took a long time, but it's finally finished and it looks great. So we did a ribbon cutting last week, and Lee spoke at the ribbon cutting. It was a private ribbon cutting, but we do have on our website Lee's talk that he did, and we also have on our website the 3D tour. Actually, Dana Shago of Shago Real Estate came out, and he used his 360 camera, and it was amazing. I went in with him and kind of helped him out. So what was neat about this is that you can actually go through and walk yourself through this entire tour of the ER. So even though we can't do tours in person, you can go online and walk through the entire thing. You can see all the rooms. When we filmed this was really early in the morning, so we didn't have anybody in the ER yet. So it was really great. We could walk through all the rooms. He filmed everything. So it's kind of nice that you can go through and see in the entire renovation, every single room. I think he did every single bathroom, every sink. So it's virtually, like being there. So that's on our website. So it was really great to work with him. He is definitely a professional, and this is, what he does for a living. You can tell he came into the hospital and, knew exactly what to move, what to do. So
this is the waiting area here, but I just kind of talk a little bit about that, because I think people are going to notice that it's a lot lighter.
Yeah, so if you move a little bit forward.
This way?
To the other way. Yeah, that's the waiting room.
Yep.
Yeah, so it's a lot brighter. It's all new floors, all new lighting.
It's opened up.
Yes, and it's a lot more open space. And if you go into the actual ER, that's a lot more open, but not as open as it was before. So before, if anyone remembers, we did have the beds lined up with only curtains that were in between them. So now everybody has a door for privacy that you can close. It's also great for contamination, to keep everyone separate. So that's the biggest difference in the ER, is really just some added privacy for all of our patients.
And not only for the patients, but also for the doctors and nurses too. Mm-hmm. They have an area that's not just out in the middle and open to everybody, right?
Right, which is how it was before. So they have their own space with their own computers, which also helps with HIPAA, keeping all the patient documents in a secure place.
So you mentioned the CT project. Mm-hmm. What else are you working on, and what can we expect this summer?
So the CT project is really our largest project as of right now. That's where the foundation is mainly putting all of their fundraising money. So we are going, there's the ribbon cutting. So we are really focusing on that. We hope to be done with that project in December, at the end of December this year. So after that, we will start another project.
Wow. Always working on something.
We are.
So looking back, this is a project, the ER project that's taken some time, but it has been well worth that time. If you, not that you want to get sick to go up there and to the ER, but I think if you do find yourself there, it's going to be quite a different experience. And again, it's just a lot more open, a lot brighter.
It is. I mean, it was a $2 million project overall, which is a giant expense.
And that included some additional equipment in there too, correct?
Yes. Mm-hmm. Yes. So all of our, all new computers, all new, we have a new triage area, several actually, and we have a decontamination room that was new. We added some extra areas also for patients. We added the grief room, which is, really helpful being in that large waiting room. If you go to the very end of it, there's also a private area that you can be in with your family. So $2 million project, and like I said, the foundation last time, well, every time I think I've ever spoke with you, that's what we talked about was, raising money for our ER project. So the foundation raised $600,000.
Wow, that's awesome.
So that was a big help towards that project.
Well, you have a great board, people that are committed to the hospital, the community, and when you flash back years ago and the uncertainty of what was going to happen, and then the partnership with Meadville, and there has been this great investment into the hospital and providing not only a place to facilitate the needs of the community, but also having doctors available for things that maybe they didn't have access to in the past.
Right. So joining with Meadville has been helpful because of a lot of things that you said. So we're able to bring some of their specialty care to our hospital. We have cardiology there now. We have behavioral health there. We have, a lot of other doctors there that we, basically share with Meadville that come over and see our patients a couple days a week. So that is really helpful because, we don't have enough patients, nor do we have enough to support the specialty care doctors. So it is really helpful that we can share those with Meadville.
Yeah, and the community, I think, notices because they're getting a great level of care, and that's wonderful. Well, a lot to be excited about, Kelly. Again, there's a lot going on. If you are golfing next week, have fun and know that that money is going to go to a fantastic project. It's going. I think people are just excited to get together again and just go out and have some fun.
Right. Yeah. So. Yeah. We are scrambling to make the golf scramble great. So that's what me and Holly are doing this week. So a lot of work goes into it, but it's going to be a great event. So thank you to everyone that supported us in this event and sponsored and is putting a team in. And like I said, if you want to make a donation towards it, give the foundation office a call.
Yeah, lots of ways to do that, right? Becoming a
Yes.
sponsor, gift baskets. And
Yeah.
if somebody else maybe has something else that they want to ask you guys, they can call the hospital and talk to you guys to
Yes.
have
yes.
that conversation.
And, we've had people that donate, a $25 gift card or, a basket. We had, some local folks just, give us some stuff out of their store, like a T-shirt, a hat. So really helpful. Those are all really great. We can put those together and raffle those off. So
Great. Kelly, great seeing you.
great to see you.
All right.
Thank you, Luke.
All the best.